This is Emilly Mackler, the pharmacist, and I'm Danielle Karsies, the dietitian associated with the Symptom Management and Supportive Care Clinic at the University of Michigan Comprehensive Cancer Center. Soy is a protein and fiber-rich food that's also low in fat. It's part of the legume or the bean family, and it's often used as a protein or a dairy substitute for vegetarians or people who are lactose intolerant. A serving of soy food, a whole soy food, would be something like a half cup of miso or tempeh or tofu, a cup of soy milk or soy yogurt, or an ounce of cheese. Another thing would be like a quarter cup of soybeans. Edamame is another common thing that people have, and that would be about a half cup for a serving as well. The soy foods that I was talking about before would be considered your whole soy foods. The miso, the tempeh, the tofu, and the soy yogurts and milks. There's also soy supplements that are out there that are things like soy protein isolate that you can add to milkshakes that you might be able to get at a health food store, as well as a lot of foods that are nowadays supplemented with that soy protein isolate, things like cereals and granola bars and other foods along those lines, as well as meat substitutes like soy hot dog, or the meatless ground meats that you can get at the grocery store. Those are considered supplements, and you can get higher doses of what the isoflavonoids that have been shown to have benefits from the cancer standpoint. And we worry about from that standpoint that we might be getting too much. Plus, most of the research that has been done for cancer benefit has been done on whole foods, and there's an assumption that the components between what's in the food itself versus just the soy itself has more of a beneficial effect.
There's been a fair amount of research with soy and its potential benefits in prevention of cancers and even in the prevention of cancer recurrence. Much of this data is in the breast cancer patient population, and Danielle and I have both had many questions that have come up regarding the use of soy in our breast cancer patient population. The data that has been done with this patient population typically has looked at the use of soy foods rather than supplements, as you recall Danielle's description of the two. And there is some positive data showing that the use of soy food could be of benefit in preventing breast cancer recurrence and could be of benefit in preventing breast cancer in general. However, there is some controversy surrounding this, and part of that is regarding patients who have estrogen positive breast cancer. The reason for this controversy is that soy has some estrogenic effects, or can also bind to these estrogen receptors. And some researchers feel that this may be a benefit in the breast cancer treatment. Some feel that this actually could be harmful and could lead to the breast cancer's growth. That data is still not available to us, or is not conclusive, and so it's very difficult to make a firm recommendation regarding this. There's one other area that's somewhat controversial within our breast cancer population, and that's that in patients who do have estrogen receptor positive breast cancer, standard treatments may include hormone therapy. You may have heard of drugs like tamoxifen or aromatase inhibitors that are used for this, and there is still controversy regarding if soy products may inhibit the effect of these agents. Some data shows that it may still be useful in those settings. Some data shows that this may not be useful, and so the jury's not out on this yet. Our recommendation to you is that you discuss this with your healthcare provider if you do have a diagnosis of breast cancer, to obtain more information. In addition, it's probably fine to eat whole soy foods, as Danielle described, and she'll talk in a little bit about what a standard serving size is and what is typically recommended as safe. It's probably not a good idea to take high soy supplements that you could find in powder and oral supplementation that are very high doses, because there really is no data looking at that amount of soy supplementation. There is less research with soy in other cancers. However, it is thought that it could be beneficial because some of the other properties that Danielle alluded to, such as the antioxidant and anti-inflammatory properties of soy. Our recommendation, if you are currently undergoing treatment for another cancer type, would be again to talk to your provider, as antioxidant therapies do have the potential to interact with certain chemotherapy agents, and it would be useful to review this before you again take any kind of supplements. However, the amount that one would consume within a normal diet is unlikely to be of concern.
If you're not currently eating soy foods, whole soy foods, there's no reason based on the evidence that we have to date that you need to start eating those soy products. If you are somebody who normally does eat soy products, like using soy milk or regularly using tofu, there's no reason why you can't continue doing it. If you happen to be somebody who is on tamoxifen or ER positive, you probably want to limit yourself to about 2 to 3 servings a day, or about 25 milligrams of the isoflavonoids a day. Again, trying to avoid taking it in the soy supplement form, because we can get a significant more amount of that, close to the 50 or 60 milligram range, depending on how much of those you're including in your diet. The other thing to keep in mind as well is that this should really be just one dietary factor that you're focusing on. The things that you would probably want to focus on first would include maintaining a healthy weight, eating 7 to 9 servings of fruits and vegetables a day, focusing on whole grains, not as many processed foods, low-fat diet, everything that's purported for general good health before you think about adding a soy product in.